It's very relaxing. I can kind of just trail off into my own world while I'm doing it.
Artwork is not only relaxing for this 21-year-old, but a way to be in control.
I kind of get to control everything that I'm doing when sometimes I don't get to control everything about life.
Life hasn't always followed a straight line for the artist. Born a biological female, they now identify as non-binary, but didn't want to be seen on camera.
I mean, I've never been comfortable in my own skin, and that's really difficult. And that's why I've pursued this avenue, to start to feel more comfortable.
That avenue is gender-affirming treatment, including a bilateral mastectomy, sometimes called top surgery. The paperwork was in place with the surgery scheduled for July 24th at Penn State St. Joseph Medical Center in Reading.
I'm finally going to be comfortable. I'm finally going to be welcome in my own skin.
But the day before the surgery, the patient, who asked to be called Jean, and her mother took a phone call from 2 employees at the hospital canceling the operation.
Honestly, it felt like grief. It felt like I was mourning the loss of this new person I was supposed to be.
And I even said to the ladies on the phone, I said, my biggest concern right now is I need to now go make sure that my child isn't going to make a decision that could really change the course of their life.
In a statement to News 8, Penn State Health said, "We are aware that a surgeon affiliated with our Penn State Health St. Joseph Medical Center has performed some top surgeries on transgender adults. This is not aligned with the principles of the Catholic healing mission that guides St. Joseph Medical Center." The Vatican had released a doctrine in April rejecting the idea that gender can be changed.
I think canceling a patient's planned surgery at the last minute is cruel.
Dr. Deborah Stolberg researches the effect of religiously sponsored health care on reproductive health.
I'm alarmed that this may be a sign that more transgender or gender non-conforming people around the country may face denials on the basis of their hospital's religion in the future. Make no mistake, gender-affirming care is medically necessary care. It is life-saving, life-affirming care.
Healthcare providers that receive federal funding are required to comply with the Affordable Care Act. The ACA prohibits discrimination on the basis of sex, which the Health and Human Services Department says includes discrimination on the basis of gender identification. But that interpretation has been challenged.
There is still this question of how courts are going to interpret the meaning of sex for the purpose of various non-discrimination statutes.
Attorney Alana Redfield focuses on LGBTQ+ issues at the Williams Institute at UCLA Law. She says health practitioners cannot be forced to perform procedures that conflict with their moral or religious beliefs, but it's not clear for health systems that receive federal funding.
I think that gets a little bit more of a gray area where there may be an obligation to find a way for people to access such care.
Penn State Health says it's committed to providing care for transgender and gender diverse individuals at its non-Catholic hospitals.
I didn't intentionally seek out a Catholic hospital to do this. It just so happened that my surgeon worked there. I'm told my place isn't at St. Joseph. It's not with this surgeon. And that's really devastating.
The artist, who often depicts the human body in their work, hopes to have the surgery at another hospital and finally feel comfortable in their own skin. Susan Shapiro on your side, WGAL News 8.